Hello guys, today I'm going to share you about an interesting topic. Before that, I'll display a ECG on the screen. You just try to interpret the ECG and try to identify the condition. Okay, today my topic is Brugada syndrome. It is a genetic condition in which the electrical activity of the heart is abnormal due to channelopathy. Channelopathy means a group of disease caused by dysfunction of interacting protein. It may be inherited or acquired by other disorders, drugs, and toxins. The causes of Brugada syndrome is defect in certain gene that handle sodium. It can be inherited from just one parent, but nowadays this gene mutation is developing newly also. Clinical manifestation for this condition is fever, dizziness, fainting, gasping and labored breathing, particularly at night, irregular heartbeat and palpitation, extremely fast and chaotic heartbeat, sudden cardiac arrest in young adulthood. How to diagnose this Brugada syndrome? There are two ways till now. The first one is genetic testing. This is used to confirm the specific genetic mutation, and the second one is ECG changes. ECG will show the specific Brugada pattern that includes bundle branch block and ST segment elevation in V1 and V2 leads. How to identify bundle branch block? The QRS complex duration is greater than or equal to 120 millisecond. But normally the QRS complex duration must be 80 to 100 milliseconds only. And the second, RSR wave in V1 and V2. Or inward deflection, S downward deflection, again or inward deflection. So the ECG will be like this, and it indicates single ventricular depolarization. And from V1 to V6, S wave duration is greater than R wave duration. The second ECG changes in Brugada syndrome is ST elevation in V1 and V2. The ST segment elevation is easy to interpret in the ECG. It will be like this. And finally, the treatment for Brugada syndrome is quinidine. Why we need to give quinidine for Brugada syndrome? The actually action of quinidine is antiplasmodic drug, but it also has protein synthesis function. That's why the doctors are prescribing quinidine alone or along with medical device called ICD, implantable cardioverter defibrillator, to maintain the heart rate. And the final shock news about Brugada syndrome is sudden cardiac death will happen if it is not treated properly. That's all about the Brugada syndrome. Thank you for watching.